Hello, today we'll talk about oculomotor nerve, that is the third cranial nerve. It starts from the upper part of the mesencephalon, that is the midbrain. Okay, so this is it. Okay, so this is a midbrain at the level of superior colliculus. Okay, there are two levels, like one is the level of inferior colliculus and one is the level of inferior and superior. So we have cut it the section from the superior colliculus. This is interpeduncular fossa. Okay, this is subarachnoid space where CSF is there. These are the two peduncles of the, and in between there is a space that is known as interpeduncular fossa. So this is a cerebral aqueduct in here, cerebral, and around it it's a gray matter. Okay, this is I'm giving you just to locate the nucleus of third cranial nerve. Now here there will be the nucleus. There will be two nucleus. Okay, one is, and these nerve fibers will pass, this nerve will pass through the interpeduncular fossa through oculomotor sulci. In this fossa there is oculomotor sulci. Sulci is just a ridge, okay, any like this kind of place. We have two projections and there is a space that is sulci. From here the third cranial nerve passes. This third cranial nerve has two type of fibers. One are the somatomotor fibers, one is visceromotor fibers. Visceromotor fibers are also parasympathetic. They are also parasympathetic fibers. So this has one different nucleus, that is Edinger-Westphal nucleus. Now the somatomotor fibers, as you can see, this is motor, somatomotor. So these are the general afferents. So these supply this oculomotor. Oculo means eye. So it will supply the extraocular muscles of eye. Okay, and this visceromotor supplies the intraocular muscles. So what are extra, what are intra? Let's talk about it. So if I'm making an eye, just a big diagram, not anatomically correct. Okay. This is constrictor pupillae and this is dilator pupillae. This is ciliaris muscle over here. These are the intraocular. This is the eye and this is inside the eye. So these are known as the intraocular muscles. These muscles are supplied by this parasympathetic muscle fibers or visceromotor fibers. If we talk about the extraocular muscles, then this is medial rectus. Okay, here it's superior rectus. Okay, here this is Levator, Palpebrae, Superioris, and this is like Palpebrae. So Levator, Palpebrae, Superioris. Here inferior rectus and inferior oblique. Okay, this Levator, Palpebrae, Superioris has two parts. One is this part and one is this part. This part is involuntary part. Involuntary part, or it's also known as muscle of Muller. Why it is like this is Levator palpebrae, that it will elevate your palpebra, that is eyelid. When you want, you can elevate it, that is voluntary. This part is voluntary, that whenever you want to elevate your eyelid, okay. But when you have already elevated, then you don't have to then it is involuntarily opened. Means you don't have to put any effort to keep it open, okay. Because that is, if it is opened once, it is opened, and that is opened through involuntary. That is muscle of Muller of Levator, Palpebrae, Superioris. There are two other muscles also, that is superior oblique and lateral rectus, but they are not supplied by oculomotor nerve. So here these five, there are 5 extraocular. inferior rectus, inferior oblique, medial rectus, superior rectus, and levator palpebrae superioris. These are the extraocular muscles supplied by oculomotor nerve, somatomotor fibers, and these constrictor, dilator, and ciliary are the intraocular muscles. So after passing through this interpeduncular fossa, like this, from this, the two fibers of the third cranial nerve, it will go ahead and it will go into the cavernous sinus. So if I make this is, I have made a little wrong. Okay, you'll manage. So here, this is the lateral wall of the cavernous sinus. Okay, that side is the medial, this is anterior, this is posterior, this is upper. Okay, so the third cranial nerve, this is the parasympathetic fibers which goes down. Okay, and then these are the somatomotor fibers. Somatomotor fibers divides into two, that is superior division and inferior division. Okay, and this parasympathetic fibers, these will go with the the somatomotor fibers inferior division. This is superior, this is inferior division, this is parasympathetic. So the parasympathetic will go with the inferior division of the somatomotor fibers. There is one point that you have to remember, that the parasympathetic fibers are above the somatomotor fibers. It is important clinically, as if there is any kind of pressure or there is uncal herniation in the midbrain, then due to the pressure, firstly this parasympathetic nerve will be nerve fibers will be damaged, and there will be no effect to this somatomotor fibers. So you will see the diagnostic features which are related to parasympathetic. That is, there will be no constrictor pupillae action, so the pupil will remain dilated. As these three muscles which I have told you, I forgot, that's ciliaris muscle and constrictor pupillae. These two muscles, intraocular muscles, are only supplied by parasympathetic, because dilator, to dilate the pupil, it is the action of sympathetic. That is, if you're afraid of something, then sympathetic works, and that's why you open your eyes more. Dilated pupillae. So that is, dilated pupillae is of sympathetic, and this constrictor pupillae and ciliaris muscle is supplied by the parasympathetic nerves of this third cranial nerve. So when this is damaged, then there will be dilation of the pupil, because constrictor pupillae cannot work because of this parasympathetic nerve damage. From this lateral wall of cavernous sinus, the fourth cranial nerve also passes, the fifth cranial A part and fifth B. What is fifth? That is trigeminal nerve. A is the ophthalmic division and B is the maxillary division. Mandibular division doesn't pass through the cavernous sinus. So this fourth cranial nerve, trochlear nerve, and these two, these all passes through the lateral wall. Sixth cranial nerve passes through the cavity of the cavernous sinus, like inside. Okay. Now after passing through the cavernous sinus, they will enter into the orbit. They have to reach the eye, so they will enter the orbit through superior orbital fissure. This is the superior orbital fissure. Ahead of it is orbit. The extraocular muscles of the eye originates from here, from a ring over here. I'll draw. Here it's the optic canal. From here the optic nerve passes. Okay. Optic nerve and ophthalmic arteries passes through this optic canal. This is the medial side. So this is medial rectus, this is inferior rectus, this is lateral rectus, this is superior rectus. Okay, and this ahead is Levator Palpebrae superioris. So these muscles take origin from here and forms a tendinous ring. So some of the nerves passes through this tendinous ring and some outside the tendinous ring. The superior branch of this somatomotor fibers passes through here only. Superior branch. Inferior branch also passes. Inferior branch along with the parasympathetic, and the fourth cranial nerve passes here, passes through this. Okay, then these are the branches of the ophthalmic artery of the ophthalmic nerve. This is lacrimal, this is frontal, and this is nasociliary. These three are the branches of ophthalmic nerve of fifth cranial nerve, that is trigeminal nerve. So that's ophthalmic branch, 3 divisions. So these also pass, this I have told you now. The involuntary part of the levator palpebrae, it is supplied by the sympathetic fibers. Okay, as we know, this parasympathetic fibers are going with the inferior branch, and this inferior branch itself is going to inferior oblique and inferior rectus. Okay, so the parasympathetic fibers will eventually go with the inferior oblique muscle. Okay, but but it's one branch from here. There is a ciliary ganglion. Okay, ciliary ganglion. So this from here, one branch will go to the ciliary ganglion of parasympathetic fibers. Rest will go there, and one branch will go to ciliary ganglion. From ciliary ganglion, the parasympathetic fibers branch will go. Parasympathetic fibers branch will go like this. So I'll tell you in neat diagram. This is ciliary ganglion. Here comes the parasympathetic fibers, one branch. Okay, the rest are going to the inferior oblique. So one branch is going to the ciliary ganglion. From here, this is a ganglion. So postganglionic fibers arise, and postganglionic fibers come and goes to this part and emerge here as short ciliary nerves. Okay, as short ciliary nerves that are 8 to 10. Okay, from here, these from here it supplies the constrictor pupillae and ciliaris muscle. Most of these nerves, this parasympathetic nerves, supply the ciliaris muscle, and like 90% to the ciliaris and 10% to the constrictor pupillae. Okay, so this was the course of third cranial nerve. Now let's see about the defects. If the third cranial, that somatomotor fiber damages, somatomotor fiber supplies the ocular, extraocular muscles. Okay, firstly, if we talk about superior rectus, if superior rectus got damaged, you cannot elevate your eyeball. Okay, if this inferior rectus, then you cannot depress the eyeball. Okay, and then if levator palpebrae superioris, then you cannot elevate your eyelids. There is drooping, that is ptosis. What is that condition known as? Ptosis, that is drooping of the eyelid. If medial rectus got damaged, then you cannot adduct. Adduct is inside, you cannot adduct your eyeball. Inferior oblique, then you cannot elevate your eyeball. So yeah, inferior oblique, then you cannot elevate. Superior oblique, you cannot depress. These are the two different functions. Okay, because there are two parts of inferior oblique, like this, coming like this and then emerging like this. So if this is contracted, it will go ahead and it will elevate the eye. So if it is not working, then it will not get elevated. So only two extraocular muscles are working, that is lateral rectus, which is supplied by 6th cranial nerve, and superior oblique muscle, which is supplied by 4th cranial nerve. These two are working because they are supplied by this. I have learned like SO4, so SO4 and LR6. Okay, this is a way to remember. SO4, superior oblique, and lateral rectus. These two are working. If this lateral rectus is working, what is the function of lateral rectus? It will adduct your eye. So the eye will be adducted, and superior oblique function is to look down. It will depress your eyeball. So your eye will look like this, like down and out. Like this, it will adduct and it will look down along with ptosis. So this is a condition which happens when somatomotor fibers are not working. Condition is known as external ophthalmoplegia. External ophthalmoplegia. Now if the visceromotor fibers fail, now the constrictor pupillae doesn't work because it is supplied by these parasympathetic fibers, but dilator will work because it is supplied by sympathetic. Sympathetic, danger, so you will dilate your pupil. So these are working, so your pupil will be dilated. Okay, that is known as mydriasis. That is known as this condition, mydriasis. When your pupil is blown out, like it's full open, dilated, that is mydriasis. And this ciliaris muscle is also not supplied by parasympathetic, so there will be paralysis of ciliaris muscle. That is cycloplegia. Plegia is paralysis. So there is paralysis of ciliaris muscle. What is the role of ciliaris muscle? Ciliaris muscle is this is a lens. when a object is far or it is near, it maintains the shape of the lens so that there is clarity. So if these are not working there, it leads to blurring. You see the object blur. So whenever there is light, whenever you experience a lot of light, then you cannot constrict your pupil. It will be dilated, so it will cause irritation. So this condition where your parasympathetic is not working, this is known as internal ophthalmoplegia. Why internal? Because it is supplying the intraocular muscles, parasympathetic. So there are two: external, that is by somatomotor fiber damage, and visceromotor fiber damage, it is internal ophthalmoplegia. So this was about oculomotor nerve. Thank you.